Hi guys. Today we are going to see about medical termination of pregnancy. It is a deliberate act to bring about the cessation of a viable pregnancy. Okay, so if it is less than 24 weeks, it is considered as legal if it is done by a registered medical practitioner. Now, coming to the indications, when and all you have to do a medical termination of pregnancy, that is, the indications are a woman who conceived accidentally of any reason, or a woman health makes it dangerous to continue a pregnancy, both for the mother as well as the fetus. It is considered dangerous, then we have to terminate the pregnancy. Or else a woman who needs completely remove an early miscarriage or any fetal abnormalities detected. So these are all the indications for a termination of pregnancy. Now, what is the advantage of doing such medical termination is that it is a non-invasive procedure, first of all, and it is a safe and effective method for early pregnancy. The added advantage, it is done under medical supervision. Okay, so now what and all investigations have to be done before doing a medical termination of pregnancy is that first of all we have to check the beta HCG levels and send a high vaginal swab, blood group and ultrasound. Okay, so what are the complications of doing such terminations is that first of all, incomplete termination, which may require surgical intervention. And the next thing is infection, such as pelvic infection, can cause fallopian tube damage, leading to infertility, traumatic injury, psychosocial problems, cervical shock. Okay, so why there is a shock is that vasovagal syncope produced by stimulation of the cervical canal during dilatation may occur and the patient may go for shock. So now coming to the management, how will you manage? That is, first of all, you have two managements, that is medical and surgical. If we consider medical, only if it is less than 9 weeks. Okay, so in less than 9 weeks we can give mifepristone 200 mg on day 1, followed by misoprostol 800 mg on day 3. So mifepristone, what is the action of this drug is that it blocks the progesterone, sensitizes myometrium to the prostaglandins. Okay, whereas misoprostol, it is a prostaglandin which stimulates the uterine contractions and softens the cervix. So stimulates the uterine contraction and softens the cervix. This is the action. So based on these drugs, that is Medicala, we can give mifepristone 200 mg on day 1, followed by misoprostol 800 mg on day 3. Okay, so mostly this does not require any intervention. Now coming to what are the contraindications for these mifepristone is that if the mother is on any blood thinner, or there is an ectopic pregnancy, or if the fetus is more than 9 weeks, or the patient is fitted with IUD, intrauterine device, then we should remove the intrauterine device before taking mifepristone. Okay, so these are all the contraindications to mifepristone. Now coming to, this is about the medical management. Now coming to surgical management, it is done only if it is more than 9 weeks. So what we give is that misoprostol 400 mg 3 hours prior. Okay, so if it is less than 14 weeks, we'll do suction curettage. That is, cervix is dilated using metal dilators. Now suction curette is used to remove the products of the conception. Now uterine cavities are checked with curettes to ensure adequate removal of the products of conception. This is one method. If it is more than 14 weeks surgical, what we do is dilatation and evacuation. So cervix dilated more to allow the forceps insertion, and it requires feticide such as intracardiac injection of potassium or lignocaine. So this is about the management of MTP. Now what are the side effects of doing such terminations is that general side effects such as vomiting sensation, headache, increased body temperature, chills, more frequent bowel movements. So these are all the side effects. Okay. So I am leaving you with a question. Suppose a 20-year-old woman presented at with 7 weeks of gestation, she is unwilling to continue the pregnancy. That means, what are the drugs are used for medical termination of pregnancy in this case? What are the drugs we prefer for this case for medical termination of pregnancy? Do answer in the comments below. Thank you.